Hey, everybody, welcome back to another episode of the Hugh Capital Podcast with yours truly, Jaleesa JuJu Fontaine. Thank you all so much for tuning into another episode. I'm really grateful for you all. I mean, the support is endless. You all are still here with me after all these episodes that have been published, and I'm really, really grateful for that. But it's not about me, it's about my guest, and his name is Duke. And the reason why I'm so excited to have him here today is because I consider him a friend. I admire the heck out of him. He does amazing work. And this is not just in his job. This is like in terms of business, entrepreneurship. I mean, I can even say that I go to his events and I've actually benefited from it. I made new friends, developed new professional relationships. Like the credibility is up here. All right. So when I bring him to you, I don't bring him as a stranger. I'm bringing him as somebody who I can really say y'all need to pay attention to. This is now, this is 5 years from now, and this is 10 years from now and beyond. Now, before I get too excited and start bragging about him too much, because I can do it all day, I'm going to let him tell you who he is.
Man, Juju, first of all, thank you for the love. I receive all of that. I received that. I appreciate that. But yeah, how's everybody doing today? My name is Dr. Duclas Charles. I'm a pharmacist, born and raised in Brooklyn, New York. Went to school down in Washington, D.C. at the Howard University for undergrad and for pharmacy school. Been practicing pharmacy for a little bit over 8 years now. Back here in New York, I've done a little bit of everything in pharmacy, community pharmacy. So that's like your CVS or your Walgreens. Worked at a hospital before in Brooklyn. Worked at a tech startup before in the pharmacy space, and most recently, I've been working in the cannabis space, which I truly love and enjoy. But outside of pharmacy, I'm a community builder, I'm a social entrepreneur, pharmacist, connector, creative. So just bringing people together is what I love to do. Been doing events for over 13 years now at this point, here in New York for about 8 years. So it's just been an exciting journey. And from my experience doing events and being in healthcare, I actually brought those two things together and started a community called Black Health Connect, which has grown immensely in the last 4 years. And that's actually how Jerlisa and I met each other, right? Through that. And that's the event she's always showing up to, meeting new folks. And that community is such a supportive community. I'm excited to be here today with you to talk about that, talk about my journey. Yeah, just be on this podcast.
I actually really enjoyed that intro. And obviously, I already know these things, but I feel like there are so many things that I felt like I would have to tell them that you may skip over. But you honestly sold it yourself. Listen, you know what that means, y'all? That means that he's always bragging about himself. Now I'm joking. Imagine. No, what that really means is this is a person that probably gets invited to speak to a lot of different people and groups of people because he's doing so much important work. And he's probably very used to having to share these stories because, well, everybody wants to hear from him. And maybe you didn't know you needed to hear from him, but you're about to find out why you need to hear from him. So, what I want to start with, and first of all, did you even mention where your family is from? Because I don't think I heard that.
Oh no, yeah. Well, first generation Haitian American, born
Oh,
here, yeah, proudly 100% from Haiti. My mom and my dad came here in the 80s, and worked really hard to help me get to where I am today. So love them for that. But yeah, that's a major part of my journey, my culture, how I identify with things and how I tackle problems, and just a lot of my goals overall. I think it's not just about building here in this country, but bringing back home, and hopefully, being able to help change things and get things better, because we're going through some tough times right now. But yeah,
I
yep.
love that. I appreciate that. I had to make sure you shouted that out because, Haitians are
I
real
appreciate
extra. And I feel like if anybody heard this and found out that you were Haitian after and you didn't say that, you might get in trouble. And I don't
that.
want that.
You're right. You're right. You're right. That was the first thing I should have started with,
You
right?
get me? But you know what? I'm here to save you. I got your back.
I
I had to.
appreciate that.
But now we're going to get busy. So, what I want to talk about is when I think back to high school, I'll start there, high school, and our parents, our teachers asking us, like, hey, what do you want to be when you grow up? Like, all right, I could be a couple of things. Have you thought about being an engineer, being a lawyer, being a doctor, a teacher? And when I said, okay, I'll do the doctor thing, I actually never thought of pharmacy. And I'm interested to find out, how did you discover pharmacy and figured out that was the lane that you had to pursue?
Well, that's a good question. So it's funny. I think a bit of everything that I do now is everything I wanted to do in high school, to be honest. So I was fortunate enough to go to Brooklyn Tech High School, and so that's here in Brooklyn, New York. It's one of the top high schools in the city. You got to take a test to get in. But one of the benefits of being there, outside of taking like college level courses, was that we all had majors. So your sophomore year, you get to pick your major. Essentially, it's just like college. You want to be a bio major, a chemistry major. I actually wanted to do media. I was so into like graphic design, web design. I was coding when I was like in junior high school. And it's still stuff that I do to this day with all the marketing that I do. But the other thing that I really love was like science, right? So ended up being a chemistry major, which kind of set me up on the path that I was from a STEM standpoint. And then when it was time to pick like a career, figure out the career path, my uncle, actually one of my favorite uncles, he's actually the first pharmacist in the family. So it's like my mom's brother is a pharmacist, and he also entrepreneur, investor. He owns his own pharmacy in Jersey, does like a lot of stuff with investments. Just like I always looked up to him for all of those things. So when it was time to pick a career when I was going to college, it was a few things that allowed me to pick pharmacy. It had me pick pharmacy one. Most of the pharmacy programs have like this 6-year track where you can finish undergrad in 2 years and then go get your doctorate degree after that. So instead of it being like an 8-year track to finish, it was 6 years. And then on top of that, there wasn't really like residency or fellowship that was like a mandatory thing, right? So my mind is like, all right, I'll be a doctor in 6 years, right? If I get through all this coursework, and then I'll be able to go right into the field, start working, and on top of that, pharmacy, if you want it to be, it can really just be a 9 to 5. Like a lot of pharmacists that I know, they all do something else. Like they work pharmacy, bring in money, pay their bills, things of that nature, but then they do real estate or they're entrepreneur here. And I think it's a career that allows you to be an entrepreneur, that gives you that flexibility. It allows you to start, while you're starting your career. Where I think there are a lot of my friends who may have did medicine, right? And then like they did a 4-year residency and then another 3-year fellowship, and then they're starting to do everything else. So I think that was like, those are the reasons that pulled me into pharmacy. And then outside of that, innately something I recognize now is just like I also just love interacting with people. And pharmacists, right? We don't always get the note, like we don't always get identified as this, but we really are on the front line. Like we're the most successful health professionals that exist, in my opinion. Like you could just walk into a pharmacy, you don't have to make an appointment, and you can ask a pharmacist a question. You can say, hey, I feel like this, what do you think is wrong? Most people are gonna say like, well, technically this isn't my job, but, or you may need to go see your doctor based on what you're telling me, right? But at least you get that initial interaction with the health professional. And especially during COVID, people saw it. I saw this, right? Pharmacists were giving out all the vaccines. And even now, I just saw an article where CVS set up a collaborative practice agreement where pharmacists can now prescribe a viral treatment for COVID, right? Based on interacting with the patient, going over diagnoses, symptoms, and being able to do that. So it's just that's what I love as well. Talking to people, answering their questions, fixing things, helping people. And that was something with pharmacy that I was able to do and why I chose that career.
I actually love that story so much because I feel like I never had the chance to even ask you that. So I get to use my podcast to ask you questions I guess I never had the chance to. And it works out for me. And I actually love that story so much. And I enjoy it, especially because, once again, like when I said I'd never considered the path, it wasn't because it wasn't interesting. It just wasn't a type of doctor that anybody had like mentioned to me. Like literally, when I thought about being a doctor, it was just as an MD, like working with patients in a clinical setting, seeing them with the stethoscope and all that stuff. But no one painted this alternative path. And I feel like pharmacists are so important. They're so key to the healthcare ecosystem. Like, why is that not as popular as talking about your family doctor or something? So
Right.
I needed you to walk us through that one. I thought that was really dope. Shout outs to you. Now, what I want to migrate over to is, now that I have this understanding of like how you decided that this path was for you, and obviously we know you did that because you're now a pharmacist, I want to get some insight into your entrepreneurial journey. Like, it's very clear that you had an interest in pharmacy in high school. You went to Howard undergrad, did chemistry, got accepted into pharmacy school at Harvard. You did it. But I want to know, this person who started the Black Health Connect, how did they even just start entrepreneurship in general? Maybe even before that.
Oh yeah, that started freshman year of college, to be honest. So I've been throwing events and parties and social gatherings since 2008. I think when I was a freshman, I wanted to just get into the club for free. It was just like, I didn't get to party much in high school. That was never me. Like I wasn't really like what outside, like we say, right? But then in college, it was an opportunity to like just get into the parties for free, right? Tell people about it, promote it. And then around like the end of freshman year, I think I was really networking, trying to meet new people. Like the beauty of Howard is like you're meeting people from all over diaspora. So like I had friends from Georgia, from Atlanta, from Houston, right? From New Orleans. I was meeting the international transfer students, folks from Trinidad and Tobago, people who came straight from Nigeria over to school. So just building that network, building that community. So it got to a point where it was like, oh yeah, I'm like bringing people to the parties and I'm only getting in free, but I'm like, hey, I brought a good amount of people out. Like maybe I should like also get paid, right? So then I started, figuring things out where I was able to connect with other event producers or promoters in the city and then be able to get paid to bring my crowd out. And then eventually got to a point where it's like, oh, now I'm dealing directly with the clubs and the venues and being able to continue doing that. When I got to pharmacy school, I was 20 years old. Everybody else is like 25. Everybody's much older because I did the 2-year, 4-year program. So I finished undergrad pretty quickly. And I also, again, great with time and place, I guess, and luck. But I was like the most social person in the pharmacy school in terms of like going out, right? Everybody's like, I gotta study, I gotta do this. I'm like, yeah, we gotta study, but we gotta have fun too. So I ended up like curating all the events for the med school, the dental school, the law students. I became like the person doing all the stuff for the grad students, but technically I was still in undergrad, so I had that network and those folks to work with, and my good friends who I'm still business partners with now. We just came together and we started doing events together where we essentially had the entire campus on lock. And then after I graduated, moved to New York, and through the network that I had in DC, met different promoters and event producers here in New York, and then started replicating the same thing. Like, how do we build this community? How do we bring people together? And I think it was something I took for granted, and this goes into the Black Health Connect story, which is like about 4 years of me being back into the city. It was February. I'm like, all right, let me do something gimmicky. I guess it's Black History Month. I'm in healthcare. I'm gonna do a healthcare event for Black History Month, and I'm gonna call it Black Health Connect. It was a happy hour in 2018. It was small, like 100 people, and but everybody who came was like, yo, this was great. I met so and so. I met this. I met that. And then as I asked more questions, I started to recognize the experience I had at Howard and the experience that we have at HBCUs, which is why I'm such an advocate for HBCUs. Is I went to a school where everybody looked like me. The hospital was run by people that look like me. The mayor looked like me. The police officers looked like me at the time when I was in DC, still do. But you go to the hospital, every physician, every nurse looks like us, right? The dentist, your dentist is Black. So it was different. I went to a pharmacy school that was Howard University produces most doctors, Black doctors in the country, right? So there's a med school, there's a pharmacy school, there's a dental school, there's allied health, there's nursing, there's PA students, there's physical therapy students. So you have this network of health professionals that look like you. And then when I came back to New York, I had friends who also wanted to do pharmacy, but they stayed in New York. They went to St. John's, they went to LIU, universities here in the city. They were like one of 5 people that looked like them in that class, right? I mean, and then you get into the workforce, which was a culture shock for me coming back from DC, where I remember like my first job interview. I mean, again, 24 when I graduated, no facial hair at all. I'll send you a picture. You can like do the production thing where you put it in the corner. I mean, the guy who interviewed me asked me if I was the pharmacist like 6 times in the interview. I'm like, no, yeah, like my resume says Dr. Charles, like doctor of pharmacy, like this. this is who I am. But then and then I recognize like, oh, you're not in DC anymore. Like this is the environment you grew up in. You didn't notice New York is obviously isn't as bad as maybe like the South or something like that. But it I say all that to say, like, a lot of us in the healthcare space or in most professional spaces, we feel alone, right? So
Yep.
that's why that happy hour was such a hit for everybody who came. So throughout that year, everybody was asking me, do it again, do it again. So 2019, by 2019, I was doing entrepreneurship full time. Wasn't working as a pharmacist full time anymore. So I started doing the event quarterly. So every quarter we started doing the event, and it grew from 150-person event all the way to about 500 people at that Q4 mixer in New York. And it wasn't just the direct network of like an extension of my events network where it was like 20-year-olds, 30-year-olds. There were 50-year-old VPs in there, 60-year-old senior vice presidents, C-suite executives coming to the event. And it was really creating that intergenerational and interdisciplinary network that then became like the core of the idea. I'd be lying if I said, the idea that I'm rolling out for Black Health Connect now was what it was when I first started it. It was like that idea came to me, I saw it, and then it developed and it grew. And I think that's what it is with most businesses, right? You have an idea and you put it out there, and then you see what the market asks you to do, and then you make adjustments from there. But yeah, it's grown. So after 2019, the pandemic hit, forced us to rethink what we do. We couldn't do those mixers anymore. But that was also another blessing in disguise, because our first virtual mixer that we did, there were people logging on from LA, Atlanta, Houston, cities that, I might have thrown a party there before, but I've never done a Black Health Connect. I hadn't started traveling with Black Health Connect at that point yet. I might have done DC once, but aside from that, we hadn't been to any other cities, but people were talking about it and have known about it, that in their extended networks that people were logging on from all over the country. And that's what really put the idea into motion. Like, this needs to be a national network, soon to be international network, as of December. And we'll talk about that in a bit, but that's what really got the ball rolling for me. It's like, all right, no, people need this. And like, with what can we do as when we bring everybody together, and that started to develop like the grander and the bigger idea of what Black Health Connect has become and what it's going to be in the next 5-10 years.
Honestly, that was so well thought out. And I feel like there are so many questions that I would have asked, but once again, you just answered all of them. I feel like you clearly walked everybody through your journey. And I feel like I love the order in which you did that, because the reason why I had asked you the question about what did entrepreneurship look like for you before Black Health Connect is because people see someone with a business or a platform or a company, and they often think that was the first time that person ever created something. And a lot of times people have done things even before that, whether it was successful and it's continuous, or whether they started it, it was successful and it failed. Whatever it is, people usually had started with something else. And another example of that is like the Mark Zuckerbergs of the world. Like, everybody's like, oh my God, Facebook. Oh my God, that was his big break. Mind you, if you listen to his story, he had played with a lot of different things that never went as viral as a Facebook did. And that goes to show you that this entrepreneurial journey is not just a snapshot in someone's story. Like, sometimes it starts with something else that still exists or not, but it can also transform into new ideas, new creations that are also equally or sometimes maybe even more important for that person. So I love that you were able to walk us through that transition. And it's also relatable because I used to throw parties too back at Albany, but I didn't do it from freshman year. I was the person who was more so promoting other people's parties. And then senior year, I became SA president, and I had like prior presidents. They were telling me, they were like, yo, you a lit person. You're always promoting stuff and you get people there. Why don't you want to get paid for it? And I never looked at myself as a person to, I guess, create something that I get paid for other than a job before that. They was like, yo, you're dead lit. Like, you should be throwing this yourself. And I did. And you know what? I'm not going to lie. It helped me buy a car my senior year. I did that. I saved, it was looking good. People were having a great time. And I knew that I could use this experience to do other things. And what that looked like was, when I graduated from college, I ended up doing professional networking events when I came back to the city. afterwards. And I don't feel like I would have known how to get venues in the city to even agree to let me do those events if I didn't do parties and stuff like that before. So once again, y'all, whether it's social, entertainment, professional, it's all there. It connects. I did
100%.
that. You did that.
No, yeah, I mean, just to even add on to that, I think I just saw a video saying the same thing. I was
Mm-hmm.
scrolling, I saw a reel just talking about, there are a couple of outliers where their first business booms and like that's all they do. But for most people, yeah, you're it's an iteration of something else that you've already done. Like I love bringing people together. Most of my businesses are like a social, in terms of a sense of social entrepreneurship, like bringing the community together, helping that community, adding value to that community, but then also, being able to make money doing things that you're passionate about. And I think that's what it's been, even with parties. Like I remember there are people who still remember the graduation party I threw for them, 6 years
Yeah.
ago, 8 years ago. There are people who met their business partner, their romantic partner at an event or at a space that I created. So I think
Mm-hmm.
was always continue to push me and do those things. And then I've learned from those experiences. And sometimes, earlier in my pharmacy career, I felt like the non-traditional skills that I've grown or I've learned weren't going to apply, but moving into different spaces, especially spaces that are uncharted, where you can be, where your job isn't really structured for you just yet, I realized like, no, like this helps in work. Like, oh, I can build a website. Oh, I understand email blasts and segmentation and marketing and all of these things. And it's just like, but it came from things that, if I told my counselor who's trying to help me be a pharmacist to be like, yo, you're wasting your time. But it's no, like it's another learning opportunity. And even with like Black Health Connect, I think for me has been the thing that's been growing really fast, and people are seeing it and talking about it. But like everything I'm learning from this, I'm bringing back to like this project that I might have started 4 years ago, this project that started 2 years ago, and all those skills are transferring back and forth. So yeah, no, I totally agree with you.
I
And
love that.
you're gonna have to get you to start promoting some parties then if you still doing that.
I stopped. I felt like, it was confusing the brand and whatnot. So I had to like, put a little pause on it. I thought about throwing the parties again. To be honest, what I really want to do is, and damn, I'm kind of telling on myself, but what I think I want to start doing is throwing like large parties for my birthday every year. And I kind of like sampled with that like last year. And
Mhm.
I should have did it this year, but I wasn't locked in. So if I do start that again, I'll let you know. And everybody listening, y'all would know. I
For
just don't know
sure.
yet. But what I do want to say is you actually ended up answering a question I really wanted to highlight, which was how do you transition from just being in healthcare, knowing you want to make a change and ultimately starting a business? You answered that by talking about what the roots of Black Health Connect actually looked like. Basically, you took your entrepreneurial experience throwing parties, you realized you love healthcare, it was Black History Month, you started doing your thing, and it grew into something where, once again, from a few people to 500 and something to even your expo that had how many people? Because I don't think
Uh,
you said.
officially, we had 910 people show up. But yeah,
See, he
so
didn't say that number, but luckily I knew that number, so I had to make sure he threw that in here. So when y'all heard 500 and something, that wasn't the cap. It was
yeah,
really 900 and something that he really was able to get people to come to his event for. And that's lit. But what I do want to talk about is the way you said it, it sounds so easy and it's not, right? It's definitely hard to do this kind of work. So I want you to give us some insight into what is difficult about doing these events and curating these experiences for healthcare professionals.
man, there's so many factors in it. I think some things I think feel a lot easier for me because I've been doing events for so long. Where and the stuff that's more difficult is those are the things that's new. I think one, if it's a market that you're not present in, finding a venue is difficult, right? Especially for me, I'm working full time, so it's not like I could just go travel to a new city for a week, meet a bunch of venue owners, restaurant owners, let's see if I can convince them to let me rent out their space or use their space. I'm sitting behind a computer, going through websites, emailing the info at reservations at, trying to make those things happen. I think what makes it a little bit easier for me is that I've been in the hospitality event space for a while. So there is an extended network of folks that I've worked with essentially in most major cities, right? Like I know, and also again, Howard University, I'm gonna keep, you're gonna hear me say that. I think every time you hear me say that, just put like a penny to the side. You're gonna have at least $1 by the end of this interview. But that network is just strong as well. So it's like, all right, I've never been to Charlotte. Who do I know in Charlotte? Who, all right, do you know a promoter in Charlotte? Okay, you're all right. Oh, well, listen, I do regular events, but also I'm doing this professionally focused event. Can you help me with this? And like, I already speak the lingo. I understand that. I think the other piece of it that also isn't difficult is like, how do you tap into these networks, right? So similar to you, I was the vice president of the pharmacy school, my third year of pharmacy school, and then I was also the PR chair for the Grad Students Association. So essentially, it was like the governing body over all the grad schools, and I did that, and then for the last 2 years that I was in school. So I was also coordinating, all of the different schools to come to events together, to come to programming together, all of that. And that's kind of like what the technique that I kind of leverage even when I was promoting parties is like, hey, all right, I'm throwing this party, but let me go talk to, whether it's the fraternities, like, are you doing an event? Do you need an event? Like, all right, come help. Like, this event is your event too, right? You get what you get out of it. I get what I get out of it, right? So it's like, how do you make things what's mutually beneficial for all parties involved? And I think, again, luckily for me, a unique space of being a health professional who likes doing events, who likes partying, which isn't like the norm, I think all the time, is a lot of the organizations that I've been partnering with and working with. They seek that social space for their membership, right? They're also trying to grow their membership as well, right? We have a lot of nonprofit organizations that are focused on different professional groups. Like, I'm a member of NPHA, which is like the National Pharmacists Association. But there's also APHA, which is the American Pharmacists Association, right? So APHA was started a long time ago, before, Black people could even be pharmacists, right? And I'm sure there was a point where they didn't even let Black pharmacists join, right? And I don't know when that changed, but that's why NPHA exists. And we have that in most of our professions, where it's like the National Dental Association. You'll find a lot of the Black dentists. National Association for Health Service Executives, NACI, right, is where you see like a lot of the admin folks in our space. A lot of those organizations started maybe like 40 years ago, 50 years ago. So as the organization gets older, their leadership gets older, it's harder to reach down to the younger generation. So how do you create that space to continue to drive membership? So it's like, all right, I have this event. I'm trying to create a community of all disciplines, all professions, but I also know these other organizations need spaces for their members to continue to network and grow. And it may not be in their skill set to do so. So now it's like, hey, you don't have to pay for a venue. You don't have to pay for an event planner. Just be present, bring your people. And as we all come together, everybody wins. And I think that's what's also benefited me. But I learned that from past experiences. So yeah, I don't know. The stuff that's hard is just probably like a new market. Just like, all right, we want to go to Memphis and activate, right? I know one or two people in Memphis, but I don't really know any venues in Memphis. So that's where it's going to be a bit more difficult. But that's then when you have to be strategic. Who are your strategic partners? What are organizations in Memphis that are doing the same type of work that would see value in this product that you're bringing? But yeah, and I think that's the biggest piece. But being able to tap into a network, tap into your community, always makes things easy. And yeah, that's what's worked out for me.
I love it. Honestly, I love listening to you. I love hearing your journey. I feel like for everybody else who's listening, they're also enjoying and they're also learning so many things from you that I'm speechless. And I have nothing else to ask about your journey. So that means that it's bringing us towards the end of the interview. But there's one quick question I have to ask before the final question that I ask every single interviewee. And the question that I have for you is, since you so, in love with Howard and everything like that, what's your favorite Howard memory? Like, talk to us.
Oh man, I think Howard Homecoming. That's a memory, and I haven't missed one yet. I don't plan on missing one anytime soon. I think even when I have kids, I'm gonna have to bring the babies and the babysitter, my mom. I don't know who's coming down, but we're going to homecoming. But no, just being on the yard when everybody's on the yard. I think 2010 which is my sophomore year, first year of pharmacy school, junior year, first year of pharmacy school. So we had Drake come out. It was crazy. So that Howard University Yard Fest. And then being in the event space, I still throw all the parties during homecoming. So like every year, just going down, seeing everybody coming together, seeing all the generations come together. I remember Alpha Fraternity Incorporated. So we'll be at the tailgate, and it'll be bros from 1970 meeting, bros from 2021, right? So always having that family come together, I think is what I love and enjoy about that experience. And it's homecoming is that memory that I would say, but every year that memory I add on like another year of it, and I just think about it like that. I can't, because every homecoming's been an amazing one for me. I mean Howard just in general. Every time I go back, I love it. I think outside of that, graduation was that
Yeah.
was a memory, yeah, for sure. I think graduating from pharmacy school was tough, especially with all the other interests I've always had. Um, but finally making it to the finish line was dope. And then somebody I look up to a great deal is Diddy, and Diddy spoke at my commencement. So it's just like it was a great way, full circle experience for me. So those would be those two moments that I would say I love the most about Howard University.
Damn, I should have went to Howard. Damn, I'm jealous.
You can always
Glad
go
shout
back.
out though.
We got grad schools. You can always go back. Listen.
No more school. I'm done. I can't do it. No more grad school. I'm done. But Howard is lit. I remember when I was in high school, I went to like an open house just to kind of think about applying. And I'm not gonna lie, I fell in love. It was lit, but yeah, it was expensive, and I was gonna go. So I
Nah,
get jealous when I hear all the Howard stories because I'm like, I kind of should have been there and I wasn't. But you know what? I feel like at UA we had our own little Howard, because if you know UA, you know we had a good time and you know it was lit, and that was our Howard and our niche, and I'm grateful. So
no,
I
yeah,
love the
I
story.
feel
I'm
that.
jealous, but
I mean, I totally feel that. I think I had the same experience. I mean, I got into Binghamton, I got into Hofstra, I got into Penn. I got into a couple of schools, Stony Brook, the typical, your SUNY schools.
yep,
Stony Brook is where all the Brooklyn Tech kids usually go, right?
yep.
Haitian parents, they wanted me to be nearby, but we went to go visit Howard. I had a counselor, Miss Ming, in high school.
Oh,
She was just like, you should check out this HBCU. I'm like, HBCU, like what? And then, not a lot of folks in New York, I don't think know about HBCUs. They probably a lot more now, but when I was in high school, people didn't really talk about them. But yeah, that first visit, and it wasn't even the best like weather. It was like a foggy day in April, like the week before my 18th birthday or something like that. We're walking around, and I don't know, the energy that was just coming off of campus. Like the second I stepped on the yard, I was like, no, this is where I gotta go. And then
mm,
there was like some fraternity just was crossing while I was there, so that was happening. Got back in the car to drive back to New York. I'm like, look, it's close enough you can drive, right? You can see me, but it was still like I got some distance from New York City. And then I loved it from the very first day. I didn't want to go anywhere else. Like I had options, and I was like, I wasn't going anywhere else. My parents were, oh man, they're like, no, you don't. You sure you don't want it? I was like, no, this is
nope,
where this
I'm
is where I'm.
good. Love you though, but I'm good.
And then my little sister ended up coming the year after. Same thing. Like she got into Columbia scholarship there. And still, it's like, nah, yeah, I gotta go to Howard. Like every time I visit my brother, it's an amazing time. So it's just like, yeah, best decision I ever made, to be
Okay,
honest.
legacies. I like that. I love that. Honestly, I feel like that could have also been like the best memory of Howard, right? Just being able to like set the path for your siblings to even want to go there.
Yeah,
That's
no,
not
for
good.
sure.
Well,
No,
I
it's super.
appreciate that. So to wrap the episode up, I do have to ask you one final question. And that question is, what does the future of healthcare look like?
Oh man, good question. Good question. So I'm in this space right now, working in the cannabis space, working in medical cannabis. I think I'm learning a lot about ancient medicine that is now like being brought to the forefront. I think a lot of us who come from, West Indian culture, African culture, we also have all those at-home remedies that if you look it up on Google, you're like, oh man, my grandmother was onto something. But I
Yes.
think it's future healthcare. Um, One is just tapping into more like traditional healthcare methods, and something that is being called like integrative medicine now, where it's like not just about, helping people with medicine, like Western medicine or pharmaceuticals, but how does diet affect your health? How does mindfulness affect your health? How does exercising? All of these things, like treating the whole patient and the bigger picture. And then also with like medical cannabis and cannabis being legalized throughout the country, I think we're also going to start to see a shift just towards like natural medicine, plant medicine. Like you see in other states, they're legalizing other things for medicinal use as well. But I think it's just going to open up people's thought processes to like, well, if I can use cannabis as a medicine, then like, what is this ginger in my cabinet doing, or what is this turmeric doing? And I think that's also going to be good. And just overall preventative healthcare, right? Just instead of treating people when they're sick, it's like, how do we create techniques to keep people from being sick in the first place and being healthy? And then when we are sick, like, what are ways that we can take care of ourselves as well, without having to go to a pharmacy first, so I'm not against that either. I think there's a balance, but that's the thing, there's a balance, and I think people are now seeking the knowledge to have a more balanced repertoire of techniques and methods and solutions to their health issues and issues that they're wanting to prevent or take care of.
I honestly love that. And I guess I'm a little bit more biased because I'm actually also in healthcare. So that question is very, very important to me. When you all hear questions like, what does the future of community look like? What does the future of healthcare look like? What does the future of tech look like? Those are all things that I care a lot about. So when someone answers that, it just means a lot to me. So I really do want to say thank you for answering that question. I want to say thank you for your very thorough responses to just giving us insight into your journey. And I think it was a really good interview. And I'm so grateful for you coming on this show today and letting everybody basically hear that. So thank you,
Of
dude.
course. No, thank you for having me. It's a long time coming, right? I've been watching you do your thing and grow and iterate your ideas, and we keep motivating each other and inspiring one another. So I appreciate being here in this space with you and you having me as well.
Thank you so much. Well, with that being said, everybody, all good things have to come to an end. So this is the end. Thank you all so much for listening. Bye, everyone.
Bye, everybody.